Hello. In this video, you'll learn the difference between changes associated with normal aging, changes associated with mild neurocognitive disorders, and major neurocognitive disorders or dementia. At the end of the video, I'll talk about causes of these types of problems and which things we can actually cure or fix. Yes, some causes of dementia are reversible. As I talk about the differences in normal aging and non-normal aging, I'm likely to reference some areas of brain functioning. And if you're not familiar with them, you may want to check out my other video where I go through these domains in detail, and I'll put it in the links below. Briefly, I may talk about things like basic attention and concentration, where you can focus for a little bit, or working memory, where there's a storage bucket, per se, of this is where we keep information while we're remembering a phone number or having a conversation. We'll talk about things like learning and memory and all the different aspects that go into how do you learn something and store it over time, and then how do we retrieve it when we want it. We'll talk about different aspects of expressive language, where communicating information to others, and receptive language, where we are taking in information and data from our environment. We'll talk about visual motor processing speed, not how fast you're running through the parking lot, but how quickly is your brain processing information, and also visual spatial skills. Visual makes you think I'm talking about your eyes, but assuming that you can see what I'm asking you to look at, I'm not talking about your vision per se. I'm talking about how well is your brain processing what your eyes give it. So things like assembling something, some furniture from IKEA, or driving down the street and knowing how quickly is that car coming and do I have time to turn out in front of it. Finally, we'll talk about this all-important area of frontal lobe or executive functions. Well, who's the executive? The boss, the CEO, the manager, and what do they do? Well, theoretically, the important things. So planning, organizing, problem solving, multitasking, all these more complicated domains of brain functioning that we use in our daily lives. There are some changes associated with normal aging. For years, researchers like Timothy Salthouse have documented changes over time in areas like processing speed, where it's not just that our bodies are moving slower over time, but our brains take longer to process information. That's one area where you'll see changes over time with normal aging. We can see more difficulty in learning information efficiently or how we need to learn information. Once it's learned, we might have a harder time pulling out the information on demand. There's this tip of the tongue phenomena where you're talking along and you just can't come up with the word. That happens for everybody, starting about in their 30s and slowly getting worse over time. But a lot of the changes that we see are in this more complicated frontal lobe or executive functioning, where it becomes harder to multitask. When we used to be able to do multiple things at once, that may be difficult to do. It can be more challenging to differentiate what's relevant in our environment and what's all the extra stuff we don't care about so much. So there are certain changes associated with normal aging, but there's a threshold, and at some point, people can cross over into what is not normal aging. In current terminology, we call this a mild neurocognitive disorder, or mild cognitive impairment, MCI. Now, this idea of having a mild problem means that in one of those domains of brain functioning, you have to have a problem. But the nature of a mild impairment means that it doesn't really impact your ability to live your life independently. So you can keep living normally. It's just a little bit harder to do things. Now, you might say to yourself, if it's mild, why do I care? I'm too busy with everything anyway. Well, that may be true, but the concerning part is that if you have a mild neurocognitive disorder, it puts you at risk for developing something worse, a major neurocognitive disorder. We'll talk about that in a second. But the statistics show that anywhere between 12 to 15% of people who have this diagnosis of a mild problem evolve to get worse every single year. And that doesn't mean everybody's going to get worse. Some people stay the same forever, and some people actually get better. But there is a significant risk that it will worsen. So let's talk about that major neurocognitive disorder definition. I have another video that talks about the idea of, well, what is a major neurocognitive disorder, and how it relates to this idea of dementia, because dementia used to be the term that most people used. But nowadays, this idea of a major neurocognitive disorder means you have to have frank impairment in one of those domains that we've been talking about earlier in the video. It has to be either recognized by the person, by their loved ones, or an informant, or ideally documented on formal testing, so we know there's a problem. It has to be different than you were earlier in life. If you've always been a bad driver and you're still a bad driver, that doesn't count. And it has to impede your ability to live independently. At a bare minimum, things like you can't take your medications accurately on your own anymore. Maybe you can't manage your finances anymore, so you mix up the checkbook, you pay bills repeatedly, you have late fees or overdrafts. So it's impacting your ability to live your life independently. It can't be caused by a delirium, so a short-term change in functioning. That's usually the result of an infection or a medication problem or something like that. And it can't be caused by something else like a major depressive disorder episode or having schizophrenia. So this idea that someone might have a mild neurocognitive disorder or a major neurocognitive disorder is a reality, but those words just tell us that you meet criteria for some symptoms, that you're having some problems. They don't tell us what's causing the problem or the etiology of decline. There are many causes in life that are not reversible, at least by current science. The primary cause of a major dementing disorder is Alzheimer's disease, where we see the tangles in between neurons and the plaques within neurons building up over time and causing problems with brain dysfunction. In fact, 60 to 80% of all cases of dementia or major neurocognitive disorder are assigned this label of having an Alzheimer's disease etiology. Other causes of neurocognitive decline include vascular problems, so blood flow. Now, of course, blood flow is important for your whole body, but blood flow is especially important for your brain. If your blood flow to your brain is disrupted in some way, we can have big bad things happen, like a stroke or a mini stroke, a TIA. But even if you don't have those big bad things happen, the tiny little blood vessels, the microvasculature, can have a hard time getting blood where it's supposed to go. Now, we all experience this to some extent as we age, but with more vascular risk factors, blood flow risk factors, such as not exercising regularly, not eating well, high blood pressure, cholesterol, diabetes. Any of these risk factors in yourself or loved ones can add up to increase your risk of a blood flow problem. And so these tiny little blood vessels can have more problems over time, and this can build up. On brain imaging, on MRI, these often show up as little flashes of white light. We call them white matter hyperintensities. And yes, we all have some of them as we age, but if these build up over time, you can actually experience a form of dementia just based on this microvascular damage. Another cause or etiology for a dementing disorder is the accumulation of proteins in various parts of the brain that are eventually called Lewy bodies. And Lewy body dementia, or having Parkinson's disease that evolves into a situation where somebody's experiencing dementia within the context of Parkinson's disease, can be linked to this buildup of Lewy bodies over time. There are other problems that also contribute to dementing disorders, such as a condition that starts in the front of your brain and attacks the frontal lobe and then progresses over the entirety of your brain, called a frontotemporal dementia. So these are a few of the examples of things we don't know how to fix yet. There are also many causes of cognitive dysfunction that are reversible. So we want to figure out what's actually causing the problem to know if your situation qualifies as one that we know how to fix it, we know how to intervene. For example, deficiencies in certain vitamins can cause a problem. Vitamin B12, vitamin D, folate, having imbalances in those things can cause a problem with brain functioning. certain metabolic processes like your thyroid functioning. If this is off, you can look like you have a brain disorder. There are infections that people get pretty commonly, and as we get older, if you have a urinary tract infection or a bladder infection, you can be so disrupted at the systemic level that you look like you're suffering from dementia, and they're pretty easy to treat. Psychiatric disturbances, such as depression and anxiety, can cause problems with brain functioning. There's even this idea of a pseudodementia of depression, which means that in fact, you look like you're experiencing dementia and your brain is not working well at all, but it's actually related to having severe depression that's impacting how your brain works. When you treat the depression, your brain works better. There's also a condition called normal pressure hydrocephalus, or NPH for short. And in this condition, your brain, which has spaces that are supposed to be filled with fluid, cerebrospinal fluid, may become too filled with this fluid for various reasons. And if there's too much fluid, it can put pressure on your brain in an abnormal and very harmful way. There's a triad of symptoms that we look for to diagnose this disorder. The triad of symptoms often includes a problem with gait or walking. It includes urinary incontinence, and it includes cognitive problems in those domains that we mentioned. When we see this triad, there may be a suspicion that NPH is at play, and it's a treatable condition, especially if we catch it early. So today we've talked about the difference between normal aging, mild problems, and severe problems, and some of the causes related to that. Some of these causes we can't fix yet, although there are medications to slow down the process or to optimize functioning. There are clinical trials doing so much wonderful research every single day. And there are, of course, the reversible causes where we can do something about them if we find out the cause. Thank you so much for joining me today. You may want to check out my next video where I talk about neuroplasticity and ways we can enhance this wonderful aspect of making our brains better.